Sorry, Chair, just give me a moment. It seems the sound's not coming out on the stream.
Right.
Sorry. Sorry, Chair, I think it's fine now. So there's been apologies from Councillor Okanade, and in substitution is Councillor Lydiard.
Fantastic, thank you. The next item on the agenda are the minutes. Approve the minutes of the previous meeting. Are there any hands up for issues, comments on the previous minutes? Otherwise, Councillor Maldoni.
Thank you, Chair. Just something minor. It's just on page 5, the minutes of the meeting, the extraordinary meeting that was held on the 12th of November. I asked for clarification on the data within the report regarding children arriving into Thurrock from outside the country and from other parts of the country. I haven't had an update on that. I don't know if it's gone to you as Chair.
I've not received anything. I don't recall. Perhaps that could be taken. Was the report itself presented by Michelle or Sheila?
I think it was Sarah Williams.
Sarah Williams.
Yeah.
Could that be relayed to Sarah, please? When Michelle?
So Sarah's one of my staff, Councillor Anderson. So I'll follow that up with her, Councillor Maldoni, and I'll get you that information. Thank you.
Thank you, Michelle. Okay, so with that one small comment, I think we can approve the minutes. We'll move on to the next item, which is items of urgent business. I've not received any items of urgent business, so we can move on to the declaration of interest. Are there any declaration of interest this evening? No? Okay. Well, then we can move on to item 5, which is the Youth Cabinet update, and I will hand over to our Youth Cabinet colleagues.
I guess I'm starting then. Hello. For those who haven't seen me before, my name's Alicia. I am the current member of the Youth Parliament for Thurrock. I do unfortunately, before we go into the report that we have sent, I do unfortunately have a bit of bad news. Me, Lucia and Adam, this is our last overview and scrutiny, as we unfortunately are a bit too old for Youth Cabinet by the time that the next meeting comes around. So this is our last one. So we just wanted to say a bit of a thank you for putting up with us and letting us kind of stand up for young people the past 2 years, which is crazy, the fact me, Lucia and Adam have been here for 2 years. But anyway, getting back on with the report. Obviously, we've given you guys another written report as we know how much you enjoyed the other one, and we thought, well, we're in a lockdown. What more could you want? So we're just going to quickly summarise it. So as the member of Youth Parliament, I had to take control of Make Your Mark over the winter. Unfortunately, by no means surprised, it didn't go successfully. But the statistics are in there, so we did only get 0.5% of voter turnout. But considering to nationally how awful it went, I can't complain. We did try our best. We harassed like schools in a nice way of just sending emails, but unfortunately I know schools are busy and it's been a chaotic time, so I can't exactly say it was going to go well. But you know, there was some interesting things that come out, and obviously with the top local issue being domestic violence, something that's never been on the ballot before, coming out on top was something very interesting, and the Youth Cabinet said we are going to look into it into the future, as we think it's a really important issue to educate young people on. Something that we did in January as a Youth Cabinet, we were invited to the Standing Advisory Council on Religious Education, something that we'd been involved in a few years ago, but due to kind of different people leaving and stuff like that, unfortunately we didn't have anyone kind of in contact, but we got back involved. So we kind of, a few of us went down, it was on Teams, we can't go anywhere. We obviously went onto Teams and had a bit of a chat about our experiences in religious education and how it can be improved, and kind of the whole fact of how young people view RE from all across the spectrum, whether you go to a Catholic school or whether you just go to the state schools, which, you know, it was quite different and quite interesting to hear everyone's different perspectives. And the committee themselves really did find it quite interesting and have taken points on. Obviously, this has then meant that SACRI have asked the Youth Cabinet to attend more regularly, which is something we used to do, but we're going to do it again. So I think I'm handing on to Adam.
Yep, so we've been putting a lot more work into the Curriculum for Life programme, and I can now definitely confirm the topics, which are the essential life skills, young Thurrock services, what is SEND, criminal exploitation, getting a job, and funky finance. Little bit of a fun title for the last one. So our plan is to produce a bunch of small bits of content that we can then hand out to educators and schools, and they'll pick and choose what bits they want, combine them into lessons, and they'll have material that's made by young people for young people, so that they get better learning from it. We've been in the process of creating the content since the start of this year, and I've also been working on the website, and it's about half complete. We plan to distribute it online with lots of documentation, so it's really easy for people to understand. And then, I believe we're on to Lucia after this. Unless, of course, anyone has any questions about Curriculum for Life.
Just going off of Adam's point, we presented the Curriculum for Life idea with the head teachers of Thurrock in a meeting a couple of weeks ago, and they were really big on the idea, so that's really positive as well. So in the last Overview and Scrutiny meeting, we were asked about the impact of COVID-19 on young people. So we've then taken this back to the Cabinet and gone, well, what do you think? And as a result of this, a survey was published all young people. And we got 73 responses between the age of 11 to 19, which is a really, really positive result. So the survey revealed that only 21% of participants felt that their school provided them with effective support during the pandemic. And it was clear that there was definitely room for improvement, while others expressed that schools didn't provide them with adequate support. But sixth form and colleges had better support and better responses. So when participants were asked what services or support young people wanted to see in this year and beyond, the responses were all related to mental health and wellbeing. So these main ideas, which were really, really occurring, were one-to-one support, mentoring, and someone to talk to, so they know they weren't alone. Which is something we can really work on as a cabinet, I think. Another prominent concern was the uncertainty about the job market, and as a result of this, there was asked if another youth service or youth employment system could be put forward. Young people also asked what fears they had, and their main fears were exams, mental health, and not achieving dreams. And a lot of people felt they had not been provided with more opportunities and that their voices had not been heard. I think I'm now going back to Adam.
Yep, and continuing with SEND Agenda, the Young Thurrock team has been in contact with SEND people for wellbeing, as it's been identified that they've been struggling with the feeling of loneliness, which is also supported by the survey which we sent out. And they're now providing SEND-only virtual sessions and ensuring their current virtual sessions are accessible to everybody. And I believe that's all of the items on at least our agenda. So
That means any questions?
yeah.
Well, thank you again for your update, and thank you for advance sight of the briefing note. I did have a quick question on the Curriculum for Life. You mentioned funky finance. I presume is that sort of teaching personal finance, or is it something? It's personal finance, is it?
Yeah, personal finance.
Brilliant. Well, I've mentioned once or twice in committee in the past the importance I think teaching personal finances. So I think it's really great that's an addition on that curriculum for life. And then the only other thing from me is to thank yourselves, Lucia, Alicia, and Adam for coming along to our meeting for the past 2 years. It's been fantastic to have your input. I'm sure the committee will join me in thanking you for that. But I will go to committee now. We've got a few hands up, but I think Councillor Muldowney, you were first.
Thank you, Chair. Yes, can I just echo thanks? Thank you so much, Alicia and Adam and Lucia, for everything that you've done. I haven't known you for the full 2 years, but your reports are always a high point of the meeting. It's always good to have you along, and thank you for the fantastic briefing note. Yes, it's a shame about the very low voting for the Parliament, but very, very well done on getting 73 responses back from the surveys. I think you might be doing better than the council does with some of its surveys there, and really fascinating to see that domestic violence came out as an issue in terms of the voting, etc. Really glad to see that you've supported Send Children and that piece of work has been done. I think all children with online learning, it's fantastic that we've got the online learning, but I think all children are finding it quite difficult at the moment because we're obviously being back in lockdown again, not able to go to school and socialise. It must be even worse for Send Children. So really great pieces of work. I've really enjoyed your contribution throughout the time I've been on the committee, and we'll miss you. Thank you very much for all your hard work.
Thank you
very much.
Thank you.
Okay, Councillor Smith.
Yeah, I haven't got any questions, but I would just like to echo our thanks and say that whoever replaces you have got a lot to live up to. It's been absolutely wonderful. Thank you very much. And I'd just like to wish you every success in whatever you go on to do. I'm sure you'll achieve great. Thank you very much.
Brilliant. Michelle, would you like to come in?
Yeah, thank you. I mean, I echo everyone else's comments. Massive, massive well done, guys. Genuinely, you know, as I said, you've given up your time. You know, you're involved in so many, many different things. I think the couple of points I wanted to make, particularly around the finance. I know actually Councillor Shane Hebb, who is the portfolio holder for finance in the council, has always had a real commitment to this and actually supported some specific work around offering, you know, finance programs into schools. So I'm sure you'll be able to tap into some of those things that are already sort of up and running, really. It's really interesting you talk about Send. I'll be coming on to the Send report in a little while, but I echo what Councillor Muldowney said, actually. We do recognise that it's tough on all young people, and it genuinely is tough on all young people, but those young people with additional needs, you know, it's tough in the best of times, and these are clearly not the best of times, are they, guys? So, you know, it's great that you've done that piece of work, and it's really good to hear, because it's okay doing a piece of work, isn't it? But then it's what you do with it. So it's great to hear you've not only done a piece of work, but you've then put into action some things that can support some of the outcomes there. So, you know, a really, really big well done from me. Thank you. Thank you, Chair.
Councillor Rigby, you have your hand up.
Thank you, Chair. Yes, I'm just reiterating what everyone's saying really regarding the Chair, Adam and Alicia. You're doing a fantastic job. You're very professional, so grown up for your ages as well. So it's fantastic PR for, you know, Thurrock youngsters really, and wish you all the best for the future. I'm sure you've all got amazing careers and futures ahead of you. Good luck. Thank you.
Councillor Atkinson-Bowen.
I just want to add this. Thank you for all your hard work in the last 2 years. It's much appreciated, and I wish you good luck in all your future endeavors. Thank you once again.
Thank you, Councillor. And it looks like the last hand is Sheila.
Thank you. I was really just going to reiterate what everyone's saying about how amazing you've all been. And is there a sort of a handover period for the people who come after you? Because I think they would find it really valuable if they had, even if it was just a few weeks or a few months with you, so that they can pick up the ropes, because you've made such great contributions to the work that we all do. And I know if you're doing this new, it must be a little bit scary. I don't know if you can remember back when you first came to ONS and had to talk up in front of all these adults. So I just wondered if there's any opportunity for you to do a little bit of a handover with whoever's coming next.
Yeah, definitely. So this handover process has started with other meetings. I believe there was some members that were supposed to be coming today, but if not, in our next overview and scrutiny meeting, there will be new members. And I'm hoping, if Roberta's okay with this, and obviously the committee's okay, I will try and come back and support the new members who are coming to this, and just get them used to the reports that we write or have started writing. But yeah, this handover session has started with other meetings. We're just trying to push it in this one. So yeah, that is happening.
Brilliant. Well, it looks like there are no more hands. So, Alicia?
I've actually got a bit of a question for, I think it's either Sheila or Michelle. I'm not sure whose department it comes under. From our report, we kind of obviously bring up, like a lot of young people bring up the idea of kind of mentoring, one-to-one well-being kind of being a prevalent issue. Firstly, is there kind of any sort of plans in the work for like a mentoring kind of program push thing? And then secondly, what's also going on with the school's wellbeing program service thing? Because I know that was really emphasized obviously when schools were like, you know, when full pupils were attending, but what's happening with that now? Are students still able to access that service? Or I don't go to a school in Thurrock, so it's just something that I would really like to know, because I think there's like a need for it at the minute.
Shall I take that, Sheila? Yeah. So I hope you're staying, Alicia, for the whole meeting. I know sometimes you have to dip out because you've got other things to do, but actually the school wellbeing service is on the committee tonight. So there's a report coming to committee about what the work of the school wellbeing service is, what it's going to be doing going forward. So that should answer some of those questions for you. When it comes to mentoring, we have introduced some mentoring programs in our Inspire team. So, you know, we've got Inspire Your Future. So we have introduced some mentoring there. It's really interesting, you know, the Director of Public Health did a fabulous annual public health report around, you know, violence and vulnerability. And one of the things he really pulled out there, you're all nodding because I'm sure you've heard or seen this report. One of the things he pulled out there was the importance of mentoring, and what a very useful tool sort of mentoring is. So we're building that into some of the work of Inspire. So yes, there will be some. We need to develop it further. And as I said, the School Wellbeing Services is on the committee later on this evening with a report. Thank you.
Thank you.
Thank you, Michelle. Okay, well, as usual, our youth cabinet colleagues are more than welcome to stay. Equally, if you do have other places to be, other things to do, then please do dip out. But with that, we'll move on to the next item of the agenda, which is item 6, and this is the items raised by Thurrock Local Safeguarding Children's Partnership, and we're going to receive an update on the serious case review action plan from Priscilla.
Hi, good afternoon. Thank you, Councillor Anderson, and good evening, everyone. I'll just give a quick brief, if you wouldn't mind, Councillor Anderson, just before I go over the Sam and Cole action plan on the Thurrock business unit. So I've been in post for about 3 months now, and I've met, I think, most of you, if you were here for the committee meeting just before Christmas, and I've met partners and colleagues over the 3 months that I've been here. Over the last few months, we've completed and published 3 reviews, historical reviews, of which Sam and Carl is one of those, and I'll talk through Sam and Carl after I give this brief update. The usual practice for the LSCP is, following the publication of a review, is to share and disseminate the learning that's come out of that review, and we would normally do that after each. That would be our usual practice. Because of various factors, we've got 3 that have been published, and so what we're going to do is to pull the learning across the 3 and to disseminate them together in a joint event and sharing. So some of the work that I'm leading on, which is new and creative ways of sharing that learning, could be videos, and I'm working with a reviewer on setting up a podcast which draws together the learning from the 3 reviews to disseminate that learning. And we felt that something creative like podcast would be much more accessible, or another option for practitioners to use in their armour in terms of learning. Videos are great, we'll continue to use those, but we thought we would introduce more and different creative ways of disseminating learning. So podcast is one of our new things that we're developing. Briefings on a page, so not having endless reams of paper that people need to, well, practitioners and people need to trawl through to get the learning, but something that's short, snappy, brief, and they can get that learning straight away. So that's briefings on a page. So one page with all the learning that can be shared across partnerships, practitioners, and everyone else. So much of our current work at the moment is to progress the work that's included in our action plans. We've got quite a few action plans rolling along at the time, at this current time, and I'll talk through 2 of them tonight. And that's around the learning reviews and the peer review that was conducted for the LSCP towards the middle of last year. In terms of personnel updates in the partnership, Jane Foster-Taylor, who was the head nurse for Thurrock CCG, retired at the beginning of January, and she has given us a wealth of experience, support, and knowledge to take forward, and we really thank her for the work that she put into the LSCP. She has handed over her work to Stephen Mayo, who has been appointed as the interim lead for Thurrock CCG for the meantime, and we've started working with him, and we thank him for taking up that role. We're assured by our partners and agencies that during this testing time of COVID and the pressures that it gives us, is that the work that they do around safeguarding children remains a priority and still top of their list. So it's very busy, it's very challenging. There's lots to do, but safeguarding remains at the top of their list. In terms of the business unit, we've lost one personnel member who's gone to work in another role, in another organisation. But as part of our peer review, we'll be looking at the forms, the functions and the role and responsibilities of the business team to see how we can fill that post and make sure that we are fit for purpose. We have the capabilities within the team to drive forward the action plans and all the work that's contained in them. In terms of ensuring that the team has the capability to deliver the day-to-day operational work and to actually take charge of any development work that comes our way as well, that's come out of the action plan. So moving on to the action plan for Sam and Carl. So as part of your paperwork, you would have received my report on Sam and Carl along with an action plan, which is RAG rated, so that shows the progression and the work that's been done over the last few months since Sam and Carl was published. So Sam and Carl's report was of a child aged 2 that sadly passed away, and Carl, which was their sibling. These are obviously our pseudonym names and not their real names. And at around the time, there was no presumption of non-accidental injuries or harm to Sam, and the police decided not to take any further action. The report was to cover the period of the birth of Kyle up to the passing of Sam. So at the point where the report was published, there were 5 recommendations for LSCP to improve as a service and to make this a multi-agency action plan, which is what we did. So all agencies have been involved in the development of the action plan and will take various actions to drive forward change. So initially there was some delay in the progressing of the action plan, and these were largely attributed to capacity within the business team and COVID related impact. So moving on from that, I'm pleased to say that we have gained good momentum and progress has been made on the action plan. And since publication of my report and the action plan, I'm pleased to say that there are no red actions on the action plan, because those that were red, we've now progressed further. I'd just like to bring up a few. So action 1, which is around the escalation policy, we have distributed the escalation policy to agencies, and they have got back to us in terms of the fact that they've recirculated it and in terms of what they do with good practice, so that escalation policy is shared at team meetings, staff supervisions, training and induction where relevant, and is updated at various points in the year, especially with new starters as well, and forms, again, where appropriate, parts of an induction process for staff coming online. In terms of action 2, we're developing, like I said in my opening, new and creative ways of sharing learning. So I'm working with a reviewer to create a podcast that addresses the learning in Sam and Carl and some of the other action plans that we have that will lead to, we're writing a kind of a question and answer, an interviewer and a responder that highlight some of the learning in those action plans, and then we'll be creating a briefing on a page, like I previously said, and a summary document that so condenses down the 30 or so pages of the review, but makes it much more manageable, much more accessible for people that want to get the summary and the learning from that. So that's where we've progressed in terms of that part of the action plan. Action 3, signs of safety training. Signs of safety training has been delivered, and we're moving that forward. It's going to be, our work is going to be about embedding that work in across the practice. So we've talked about signs of safety and graded care profile working side by side to address issues of neglect, and that's going to be pushed through and embedded throughout all the agency's work going forward. Action 5, all of those mini actions contained within Action 5, you'll see are green, and I'm really pleased that they are all green, because it means that they have all been completed. Now, completed doesn't mean that we just tick them off, they go green, and we put them away and file them away. We just ensure that that work is continually being done, and again, embedded across the agency. And I'll end there in terms of Sam and Carl's action plan.
Thank you, Priscilla. You touched on a question I had very briefly right at the end there, and that was to ask, about the focus that there will be remaining on the completed action plan items. Obviously, like you say, just because something's colour-coded green, it doesn't mean it doesn't still require attention and effort. And so I just I suppose was looking for assurance that would be the case, and those green rag rated actions would not stay under review, but be looked at still and ensure that they were kept to.
Yes, yeah, they will be, and a lot of the actions will form part of our daily work, and so they will be monitored along through everything else at different meeting subcommittees, through our development plan and our delivery plan. So they'll form part of our everyday work, so they'll move along and be monitored by the business team and indeed the partnership as a whole.
Okay, brilliant. I do have one or two other questions, but I will open to the committee now if there are any questions from members. It doesn't look like there is, though, at the moment. Councillor Muldowney.
Thank you, Chair. Obviously, it's very tragic when a child dies and prompts the need for a serious case review like this one. Obviously, we heard the findings of the serious case review back in July, and we've had 6 months since then. But I just wanted to talk a little bit from the point of view of the general public, because obviously Sam died in January 2018. The serious case review, for whatever reasons, took quite a long time to come to be published. And now it seems like a very long time, I think, from the feedback that I'm getting from our residents, between when the child died and us actually having an action plan to take action on the points that were raised from that. So obviously I understand that you've only been working on this presumably for the last 3 months, because that's how long you've been in post. But there's been 6 months now since we saw it in July. And I think the impression that I've been getting with people contacting me is that people feel that they don't feel like action's been taken. And I think probably this is to do with the very long period of time it took for the serious case review to be brought forward. And there is some anxiety amongst parents about this incident and just in general about safeguarding. So I think that's the first point that I'd like to make. Although I appreciate you've probably made good progress on it in the 3 months that you've been looking at it, there's still not a lot of action points have been accomplished. I mean, one of the ones that you said, number 5 on item 5, that's been marked as green because a date's been set for a training to take place. So I just had a question around that to start off with. How is an action completed if just by setting a date for a training to take place? And how will it be tracked once it's green to make sure that that training does take place and then that training actually gets embedded so that the learnings are really embedded moving forward? That's, if you want to come on that one, I've got a few other points that I would want to make, but that was one of the specific ones.
Yeah, I hear your question and your anxiety, Councillor Muldowney, and I appreciate that some time has passed since the publication of the report and now the action plan. In terms of action point recommendation 5, action 5, so that's the dedicated signs of safety and graded care profile training to be led by the consultants and to take place. What we've done is we've set the date, and that date has now been published and has been publicised. We've got agencies sending representatives and booking onto that course, and that's the start of that cycle of training. So with that, we're going to set up a whole suite of training that flows from that, and it will be tracked and it will be monitored. Starting with a kind of an awareness session. So for those practitioners that just want to know what graded care profile is, those that are not working closely with families, then if you like a level 2, so a more in-depth one, so maybe family support workers and those working with families, and an in-depth session, so 3 different levels of sessions. So we've got a suite of sessions that address different needs for different practitioners. So that date, and it is green for that reason, but yes, but it's the start of our rolling programme of training sessions, awareness sessions, and embedding it into the work that we do and into practice across the partnership.
And will that come back in terms of the action plan? I mean, how does that get tracked in terms of us being able to scrutinise that process moving forward?
I can bring back a report of the attendance and what was delivered. And so in terms of all of our training courses, we do pre-delivery evaluations, we do post-delivery evaluations, and then we do follow-up evaluations. And that tracks in terms of the need of the practitioner that attends at the outset, what they feel they've gained directly after the training, and sometime after the training, what they've actually done with that training and awareness to see whether it's actually hitting the mark and what is changing and what has changed because they have attended that session. And so that will form our training summary or our training evaluation report.
Yeah, I think that would be good to look at going forward. I mean, for the other 4 points, there's been delays. So some of that, I believe you said, was capacity within the business team. And you also said that you've lost one of the business units. So what is the current situation with capacity within the business team? And do you anticipate that causing any further delays?
So when I was referring to capacity within the business team, it was really around the person that was doing my post, my role wasn't in post for a period of time. And so there was some capacity issues there. We did have somebody from Children's Social Care covering the post, but of course that person was doing their job and this job. They did a fantastic job in my view, that, you know, as best they can, trying to juggle the two jobs. But I do appreciate that there has been some delay. I'm the dedicated person leading the team now that's been employed to drive this forward, so that is my priority, along with the business team and the rest of the partnership, to ensure that we progress the work in these action plans, not just some of these smaller areas, but all of it, and to quickly embed it into practice so that we can gain some momentum and traction in terms of delivering it as operational actions.
Great, thank you. That's reassuring to hear, particularly because, you know, we're going to hear another report. We're going to hear another 2 reports with action plans, but the next one in particular is for the partnership as well. So it feels like the local safeguarding children's partnership is at quite a nascent stage. It's at quite a beginning stage in a lot of areas. And although, you know, the independent review, I don't want to go too much into the next item, but they are connected. And as I read them, I was glad to have them together, because it felt like a lot of the same issues that came up in this action plan. There were themes within the partnership action plan as well. So I was just left with a bit of a sense that a lot of it is new, a lot of it is not pinned down yet, let alone embedded. I don't know if it would be good to have your comment on whether you feel that's a fair analysis at the moment. And although we've heard reports that safeguarding work that's going on with families that we know of, I felt that is robust. I'm just a little bit concerned and a little bit worried about families that we don't know about, particularly because we're in this lockdown again, and we've just been going through a whole year of very, very difficult circumstances where families may well have fallen into problem situations. So what's my question? My question is really, do you think that's a fair comment, that the Safeguarding Children's Partnership is sort of in a very beginning stage with a lot of the work that it's doing with these 2 action plans? And how well do you think, are people falling through the net? Are we having children falling through the net? That's my main concern, I guess, at the moment.
In terms,
as I think, you know, with Sam and Kyle, this child did fall through the net for, you know, reasons that we're acting on in the action plan.
I think in terms of your comment, if the LSCP is at the beginning of some of these actions in the action plan, I think that there are some new things that we are developing as a result of the peer review, and I think in terms of the Sam and Carl action plan, there are a few issues there that we are just kind of embedding and making sure that we raise the awareness. But I don't think it's totally fair to say that we are at the start of all of them. Some of them we've started, we just need to move them forward and develop them more. Certainly that they are in place, but we just need to ensure that we raise the awareness once again and make sure that we are doing them. So some, yes, some are new and some are things that we've already been doing, but we just need to develop them further and make sure that they are embedded and they are carried forward.
Okay, thank you.
Councillor Muldowney, I'm just going to bring Sheila in there, as I noticed that Sheila's been waiting patiently, and she I think may have a relevant and valuable contribution to perhaps a couple of the queries you raised there. So Sheila, do you want to come in there?
Yes, thank you, I do. I think in terms of, I think the very first question Councillor Muldowney was posing was that, you know, the review's taken a long time, that something more should have been happening since then, and does this mean children are not safeguarded? I think what I'd like to comment about the review itself is it was instigated by the partnership, so it's not just one agency, it's the 3 main agencies agree to this, and the review was independently chaired and the report was prepared by an independent author. So these things were not, if you like, within the gift of the partnership to say you have to do it within this period of time, because what the chair and the author want to do is a thorough job and make sure that they cover off everything that's been raised with them. And I think it listed in the report itself some of the reasons why it's taken maybe as long as it took. However, having said that, in terms of the partnership, part of when we asked for an independent review of how we operate as a partnership, one of the questions we asked was about reviews. How can they be done effectively but also quicker? So what we're not saying is let's push them through really quickly and do them in 3 months and whatever you come up with is the answer. We're saying we still need a thorough look at cases where we think that there are learning for the partnership, but also it should be a bit more timely than it has been. So that was one of the questions we asked of the review, and I think the reviewer has given us some answers about what we can do to try, should we be in that position again, to try to make the review both thorough but also more timely than it was. And I think as a partnership we all agree that we don't want reviews going on for longer than a year. Really the guidance says 6 months, so we need to do reviews that are within that time and pick up the appropriate learning that we need to pick up. In terms of practice, and I think you were asking the question about are children falling through cracks at the moment, especially the children we don't know because we're in lockdown. Some children are not at school, and maybe all the, what you might think the usual safeguards are not in place. What I can certainly say from children's social care is our doors are not closed. Our referrals are still coming into us. Our MASH is operating every single day. We have, that's a multi-agency team as well. We have staff in the building who are ready to go out when we get referrals. If somebody is saying that a child's at risk or there's something untoward's happening for a family, our social workers are going out every single day and making visits to family face to face. It's not virtual. We're out there doing physical visits to children. I think what it's fair to say is what about those children that are not being seen in the way that they would normally be by schools in particular, because schools are a real source of referrals to us in children's social care, because they see families every day and they can pick up early signs, where there's something that's happening for a family. Now, what we know is schools, is I meet weekly with CEOs and some head teachers, and I hear from the schools that they do visits as well to families where they think there are vulnerabilities. So the schools are not forgetting about those children. They may not be physically in their school, but they're also offering online learning, and the teachers are in contact with children and with families, particularly the families and the children they may feel are vulnerable. And if they're not seeing them, they're actually going. So teachers as well are making phone calls and visiting children. So I don't know if Joe wants to add anything on this in terms of from social care, but I do know our referrals are still where they were before. We are absolutely clear that we are not closed. So in terms of safeguarding, if there's a risk out there and somebody wants to make a referral into children's social care, we will certainly be responding, and we have been. So we continue to have children who are open to social workers. Children are still being looked after by us, as well as children on child protection plans and children in need.
Do you want to come back there, Councillor Muldowney?
Yeah, thank you, Sheila. That is reassuring, and I'm glad to hear that. And I'm glad to hear that you're more accessible than maybe other services in the council at the moment, where the feedback is it's very difficult to get hold of people. So it's good to hear that that isn't the case in this case. Yeah, so the other point that I was going to come back on was that the other delay in because all the rest of the points really apart from 3.2 are delayed, is that correct? Or does the amber rating mean something slightly different to the written statement of action plan?
No, so the amber are the ones that are in progress, and so that we've started them. So did you say 3.5? Sorry, Councillor Muldowney.
3.2's marked green. Yeah.
Yeah, so that's covered.
I went to the sign of safety conference actually, which was very good. So that was a good day, I felt. Yeah, 3.2. That apart from that one, the other 4 areas are.
They're not delayed, they're in progress. So if we hadn't started or done anything on them, then we would have them mark them as red. If work had been started and we're progressing through to the delivery time in terms of the timescale, then we mark them as amber, and anything that's been completed and needs to be embedded is green.
Okay. Do you use the blue for when things are embedded, or would that not come to this committee?
Yes, yeah, we can use the blue when things are embedded, yes.
That's good. Just on point number 1, just to drill down a bit more, it said about reviewing within the next 6 months the escalation procedure. Well, that would have been by January, would it?
Yes, yeah. So the escalation.
That's a little behind then.
Are you referring to 1.1?
Yeah.
So escalation policy to be circulated to all organisations, that has been done, and we have received the feedback from those organisations in terms of how they take it forward, how they ensure that their practitioners understand what the escalation policy is and what it means in terms of their work. We have also then completed the next one down, so which is the feedback from agencies on implementation, and this is where they shared their areas of good practice with us, so sharing it at team meetings, involving and discussing it at staff appraisals and staff one-to-ones and supervisions, and where appropriate, embedding it and sharing it through new starter inductions as well, so that those have been completed.
So could I just add to that particular one as well, Councillor Muldowney, is what that review said. We've always had an escalation policy, so it's not a brand new one. We've always had one. But what the review found was that some of the agencies, when they had concerns that they weren't being heard, hadn't escalated using the policy. So one of the recommendations was about making sure that the policy was understood and that agencies signed up to it and agreed to it, because it was in place, but they hadn't been doing. Some people hadn't actually raised concerns before the review started. They said they had concerns during the review, but when the reviewer asked, what did you do with that? They hadn't used a policy that was in place. So this is about making sure that all agencies, and it's a good challenge back, when they do a review, to say, you've got a policy in place, you had concerns, why didn't you use it? And that's across other agencies. So I think that was a really good challenge, but there is an onus on the safeguarding partnership, which covers all agencies, to be saying, here's our policy. I want to make sure you've all looked at this. If there's any concerns, it's really laid out clearly what each agency can do to flag up, to escalate if they've got a problem. So although it may, appear because it's been sent out again, and we're giving agencies time to really reflect on it and come back to us so that it's meaningful, rather than just sending it out again. And then we could have just ticked it and said, we sent it out, it's done. But that's not what we wanted to do. We wanted a little bit of feedback on that.
How will you know when that is, as you say, robustly disseminated, and you feel secure that if other agencies had issues, that they would raise concerns in line with that policy?
So I think the way it's been disseminated is everyone has to come back to Priscilla and her team to say, we've received it, this is where we've disseminated it, this is how we're going to use it. You're right to say, though, yet again, we're sending out policy. It'll only be we will know if there is another moment when agencies raise it. So if an agency is saying, I don't know, it could be any agency saying, we feel something more should happen in this case, or sometimes it's something less. You've intervened too much. We want something different to happen. If all the agencies have understood the escalation policy as they should do now, then we should start to see some escalation. So I'm pretty confident we could. I mean, we must find a way of being able to sort of mark those and be able to say, yes, we've had a formal escalation, because some of those escalations will come up through the LSCP. So we'll be able, I mean, the whole point of escalations is to keep it at a lower level and resolve the problems. You know, it's somehow, if you have to keep going up and up the line, you've not resolved a problem somewhere. But the facility's there to do that. And it does at some point come up through to the LSCP, to the strategic partners, if there's still disagreement in something. So we would be able to monitor that and record that. I would expect this as well to be in our training programs, and we're talking about thresholds, and we're talking about whose responsibilities are what, you know, because sometimes not all agencies understand implicitly, you know, what responsibilities lie with which agencies. So in training, when we talk about thresholds and we talk about who's responsible for which part of the work, we should be mentioning our escalation policy, so that if anyone has a concern that whatever they've raised has not been treated seriously, that they don't just stop there. It needs to go up, you know, within that escalation policy.
Yeah, thank you for speaking to that, Sheila. I appreciate that. I hope you don't mind me pushing on this one. It's just I remember from the report in July that certainly there was an issue raised about thresholds, and were the different partner organisers, the different teams that were involved in this particular case. There were concerns noted at various stages along the way, but things weren't necessarily escalated, or concerns weren't necessarily acted on or proved one way or another, whether it was a true concern or not. Certainly from rereading the report last night, that sort of became really clear. So I hope you don't mind me pushing on this one a bit more robustly, because for me that was one of the key themes that came out of the learning with Sam and Kyle.
If I could just also respond on that, we have as a partnership also updated our thresholds document, and that's also been disseminated out to partners, because you know, sometimes with thresholds there are debates and discussions. There's some things that are just really clear, as you know, this is not work that's just, you know, like scientific work. There are times when you take into account factors of family support, context, what children are telling you, what the families are telling you, what other agencies are telling you. So we have a threshold document that we work with across the partnership, and that has also been refreshed and discussed across the partnership. So we don't just impose something, we have to agree as a partnership that this is the way we're going to take things forward. So in tandem with this, you know, we've also refreshed our threshold document. So that may not have been a recommendation that came from this review, but what we know is we need to be clear that all agencies understand what the thresholds are for interventions or for not interventions. You know, that's right the way from early help, right the way up to children who then become looked after, or where we go into care proceedings on children.
Great. And just finally, sort of taking the whole action plan as a whole, how far through to completion, let's say, and it being fully embedded, do you feel we are at the moment? Just to give those who may be listening, but also the people on the committee, an idea.
Okay, so some of the work on the action plan had started before my arrival, and so that is being progressed. We're pushing it through further, but in terms of completion and embedding, I would say that, you know, we're looking at kind of the end of this academic year, because some of these actions will not be complete until we've got May on some of them. And in terms of embedding work at action 3, that certainly takes us to December of this year. So I think some of the work still needs to be done, progressed, but then if you're talking about embedding, I would say probably the end of the calendar year.
You feel all would be fully embedded by then?
That's my ambition, yeah.
Okay, thank you.
I noticed throughout that discussion that Malcolm and Joe raised their hands. Malcolm, I think you were first. Do you want to come in there?
Thank you, Chair. It was just really to offer some information in line with what Sheila had been mentioning earlier around the position of schools during the pandemic and referring to safeguarding support. So just to assure the committee that, in fact, we've got an ongoing process of monitoring the position of those children who have contact with social workers, in addition to what I'm sure Joe will mention in a moment about the social workers' contacts with those children directly. So the safeguarding leads continue to obviously monitor them and are actively working, as Sheila was saying, within those schools. Every school, regardless of the number of pupils they've got in, have obviously got their safeguarding lead still working in the school. They're giving us now a fortnightly return, a data return at an individual level. So we don't just have the numbers, but we know exactly what's happening with each child who's either got a social worker who has got an education health care plan, so we know what their situation is, and we're recording with them, when they had contact with the parent, the regularity of that content. And again, as Sheila was saying, the feedback from some of those schools is not only are they having regular contact, obviously through the virtual contact, and some of that's one-to-one virtual, but there are some of the schools that are going out and giving daily contact to those children to ensure their safeguarding welfare. And if there is any concern whatsoever, as Sheila was saying about the schools are very much the eyes and ears for us in terms of the services, then they're reporting those directly in and following up those cases. So there is that very high level of contact that would continue even with the low numbers of children attending at the moment. So it's just really to give some reassurance around that. And the figures at the moment are showing approximately 30% of those children which have a social work contact identified plan are attending, and that's because those parents have the right, obviously, to choose not to send their child to school. But that figure is slightly skewed by that some of those children obviously are children who have a contact with the social workers of disability reasons rather than safeguarding reasons, which skews that figure. But for any other child, obviously the social worker will be having a conversation with that parent to ensure that is the right move for that child at the time. And if they don't feel it's the case, they'll be taking that up directly. So I just thought it was useful from the point of view of the safeguarding and the safeguarding leads meeting we're having. Thank you.
Thank you for that, Malcolm. Joe, do you want to come in there as well?
Oh, thank you very much, Chair. I was just going to, I think Malcolm's beat me to a bit of it, really. I was just going to talk about the sort of the good work in between social care and education and sharing information about vulnerable children on a regular basis. Obviously, that's a meeting that myself attend with Malcolm, plus obviously I attend the CEO meetings with Sheila and obviously Michelle Lucas as part of that process. But just going on to the MASH sort of stuff, I wanted to just provide the reassurances that it is working. We are safeguarding children every day. There are contacts. There are people in the assessment service responding to that on a daily basis. We have seen a more of a conversion rate in our contacts. So we've seen a higher rate leading to social care intervention and early help intervention and Pass Plus being involved as well. So that's just a bit of reassurance in respect to that. And just looking at some of the aspects we've talked about, escalations, I think that was part of the question was, how would we know? What does that look like? I think we're already seeing the early signs of that in case discussions between partner agencies. And I think what they're doing is they're having them conversations at an earlier point. We're looking at our audit processes to make them a bit more creative, more having roundtables with partner agencies to have open and frank discussions about particular cases. So I think I chair the Learning and Practice Review Group, which looks at lots of the stuff that Priscilla's mentioned today about from the audits, the escalation process, the serious case reviews, the learning reviews. I chair that and have done that for several months now, so I have a sort of a good oversight of that. And I think what we are seeing is the partner agencies coming together, and I think there has been some good partnership working. I think I just want to touch base a little bit on signs of safety that was in the plan as well, just to provide again a bit more sort of clarity that signs of safety training has been ongoing. It hasn't just started because we've had the particular review. It's happened right across the service. We've moved that into the MASH and the MARAC side of things more recently. The reference to the MASH strategic board, that's been in place for about the last 2 years. That's coming into the LSCB as well. So I think there's a lot of good work and there's been a lot of response to learning, because obviously we do monthly audits and we do multi-agency audits across the LSCP as well. So we're constantly looking at that learning and responding to that learning, and how do we know and what does that look like for, and the thing we're always looking for is what is the outcome for a child and what does an impact look like? How do we see evidence of that? So that's just want to just provide a couple of sort of points and clarity on some of them views, just to provide reassurance that we are working on lots of these issues. We're seeing, and I think it's important to identify, we're seeing a lot of good practice as well. you know, we always look at what do we need to do better and to give the children the best service and the best support we can. But what I see is lots of good practice. I see lots of good partnership working as well.
Thank you, Joe. Councillor Muldowney, your hand is still raised. Do you want to comment on any of those contributions?
Yes, thank you all for your contributions, although I did say that I wasn't that concerned, having heard safeguarding plans over the course of the last few committee meetings that are currently in place. That wasn't really my area of concern. It was more about anybody who is new to the service and maybe getting missed just because of the situation that we're in. The other question that I had was about COVID. So part of the delay you said was down to COVID. I just wondered, could you give us an example of how COVID's affected going forward on the action plan, and how will this be addressed going forward? Because we don't know when we're going to be coming out of lockdown. So how can we be assured that some of these delays might be overcome moving forwards? Thank you.
Okay. So in terms of COVID, what I was referring to was the changing ways that we were working and then adapted to the new changing ways of working. So, for example, conducting virtual meetings. So some of that we had to develop over the period of time. My understanding is that we were developing that since the lockdown, and now it's something that we're doing very well. A lot of our meetings, virtually all of our meetings and our connections are done virtually, which, you know, we're really working hard. And certainly when I first started, I hadn't realised that we didn't really have virtual meetings before that. And so now I can see that that's something that's our new way of working, and we're doing that really well. Everything that we do in terms of connections is via virtual, and we've got all that ready, set up, and we're doing that really well. So there isn't a blockage in terms of that. Obviously, we've had some people affected by COVID because children are working from home, and so it's that balance of people working different patterns in order to meet the need. That's all embedded and bedded down now. So we've got a good system and rotation working going forward.
Great. So that sounds like COVID shouldn't really be too much of an impact on progress moving forward. That's good to hear. Thank you.
Sheila?
If I could just add in terms of because I think you're right to ask the question, because people just say it's COVID and it doesn't actually explain what. Some of our health colleagues, certainly in the first lockdown and through summer, were diverted away from their children's work into working on the wards and helping out anything. You know, some people were taken back into nursing who hadn't actually done nursing in a while in that strictest sense. So we did have some of our partners, and our other strategic partner is the police, who also were being, you know, pulled away to do what you might consider to be very COVID specific things around compliance and making sure that everyone was sticking to rules and etc. And also for some of our agencies, they've been affected by staff not necessarily having COVID, but either being contacts or having to self-isolate, you know, and it has meant that some agencies have struggled to keep up with their levels of staffing because they have got some people off sick related to COVID, or not necessarily sick, but isolating. But you're absolutely right. You know, we're now 9-10 months in. We are getting a lot better as a partnership and as individuals at coping with how do we work differently, how do we make this work for everyone. And certainly in this lockdown, we did have assurance from our health colleagues that wherever possible they would not move off children's workers onto other work, because it just means there's gaps for us, for our children, and how we make sure we keep that work going. So we have had those undertakings. So I feel confident, you know, that this lockdown we've learned a lot from the previous lockdowns, and actually are making sure that children are prioritised, and certainly that safeguarding is.
Great, thanks, Sheila. And presumably there's some time savings to virtual meetings with staff not having to travel, or so I don't know, maybe some of these practices we might take forward into the new normal whenever we emerge.
Okay, well, my other question was regarding delays as a result of COVID and how you you would seek to tackle those going forward. But that was well covered by Councillor Muldowney. So I think the last thing from me is just to mention that a lot of the actions on the action plan looked as though they were sort of due to be finished around the 31st of the 5th. And obviously that is just before the new municipal year. So I was hoping that we could perhaps get a return of the action plan in our first meeting of the municipal year, because that will be the June or July, which I think are the 6th or 7th month of the year. So I think it would tie in quite nicely with where a lot of the actions are supposed to finish. Is that okay with you, Priscilla?
Yeah, that's certainly something we can bring back. Yes.
Fantastic. Okay. Well, with that, I can't see any more hands. Just a nice presentation. But we'll go
Sorry,
to the.
sorry, Chair. Nicola, can you stop sharing your screen, please?
We will go to the recommendations now, though. They are 1.1 and 1.2. The committee acknowledged the progress to date against the action plan and provide oversight and challenge to ensure the actions are having impact across the agencies. I think that's been done. Can we agree those?
Agreed.
Brilliant. Okay, well, we'll move on to the next item then. And again, this is going to be presented by Priscilla, and this is an update on the LSCP peer review action plan.
Thank you, Councillor Anderson. So in August of 2020, the LSCP, previous to that, had commissioned an independent review in line with the government guidance Working Together 2018, which gives a requirement to conduct an annual review of its safeguarding arrangements. So we commissioned an independent reviewer to do that for us, and a full report was presented and presented and shared with the committee at the end of last year, so our last committee meeting in December. The review acted as a critical friend and identified gaps in effective partnership working and set down some recommendations for the partnership to increase their effectiveness. As a result of that, the report listed 26 recommendations, and they fell into 5 categories, which you'll see as finance, governance and business support, learning and improvement, quality assurance and data, shared priorities and engagement. So again, I'm pleased to report that good progress has been made against the action plan. And since publication of my report, so since you've had your papers go out, the action plan, further progress has been made against those 26 recommendations. And as a result, only 2 of those actions out of the 26 remain red. So action 4, which is around protocol to reduce duplication and streamline processes, is awaiting an agreed date to have an initial scoping meeting to have those first discussions. And I should have confirmation of that meeting in the next few days or so. So there will be progress against that once we've met and we've discussed how we take that forward. Action point 5, which is around the developing the wider role of SET. So that's developing. So that's already in place. We are working as a SET partnership, Southend, Essex and Thurrock, but it's around developing that further. And we felt that that would benefit from the input of the appointment of an independent chair and scrutineer, which we are progressing. So that action in terms of appointing an independent chair and scrutineer is 26. So at 26, I'll go on to 26, even though I wasn't going to anyway. That's in progress. The advert has gone out for that post, and we have set a date for in March to interview. So we're hoping that the successful candidate will start as early into the new financial year as possible and help us to progress some of these action points, not least the one that we're saying, action 5, around developing the wider role of SET. But I think it's fair to say that there are already lots of work going on between Southend, Essex and Thurrock already, and we just need to develop those further and find new effective ways to work into the future as well. In terms of our green actions, so action point number 1, which refers to deputies attending the strategic group meetings, that was something that was put in place very early on in December. So I think this is coming up will be our 3rd strategic group meeting, and the deputies do attend those. And we feel that by deputies attending those, so you've got the strategic and the operational leads coming together, that further bolsters the effectiveness of those meetings. Just also like to highlight some of the ambers, and you'll see that there are quite a few ambers, and they are ambers because we've started work on them, but we're just working through the finer points of them and getting them so that we know that they're completed. So action point 7, which is around revising the learning and improvement framework, we had a meeting that again was chaired by Joe, the Learning Practice Review Group, and we have discussed the revising of the learning improvement framework. It's been sent out to partners, to colleagues to comment on, and it was discussed today. Agencies and members have a chance to feedback as late as next Friday, and we're hoping that once that's signed off by the Learning Practice Review Group, that will go to the strategic group meeting at the end of this month. Once it goes to that meeting, we're hoping that it will be signed off by strategic partners, and that action will go green. So that's the action around the revising of the learning and improvement framework. In terms of action 8, which is around agreeing a multi-agency data set based on priority areas, that's something that we are starting, and we've started off small. So we've had some discussions today. So we've set out a basic data set that we discussed in the learning and practice group meeting today. And we've asked members of that meeting to have a look at what we've put down as a basic and to agree any other measures that they would like to see captured in that data set, so that we can then look at who can provide what's best for us to collect, and what we do with that information. That information, that data will inform the delivery plan of the LSCP. It will inform the work that we do in terms of targeted support. It will inform the learning, and it will inform our priorities. So there's a lot of work that will flow from the data set. In addition to that, the DFE was offering some money around developing innovative ways of, I suppose, embedding the safeguarding arrangements in LSCP. So what we've done is we've put together as an LSCP a bid funding form, which was submitted last Friday. It's not for a huge amount of money, but certainly if we win that bid, we will be able to commission a specialist data analyst to help us build that data set, and that will significantly expedite that action, because we'll have professionals come in to help us scope the data set along with our partners to see what data we can collect, what would inform our practice, how we can analyze it, and how that feeds back into the work that we do. So we're working on that, but without the funding, we'll start small and build on it. With the funding, we'll be able to do it a bit bigger and a bit quicker in terms of when we finish that off. So that's the progress we've made on the multi-agency data set. So that's quite a big piece of work, and it's resource heavy in terms of finance and capacity. So we're hoping that our application for funding will be agreed, and we'll get that money, because that would be really helpful in terms of developing in that area. In terms of action point 14, to consider bid for schools forum for contributions towards partnership, that is, if you look at the timescale behind, we have had conversations around that. There was the feeling that already with schools facing what they're facing in terms of the health situation and pressures around finances in schools, that we would have further conversations around that. So the date on the timescale has passed, but the reason why we're holding off making any other decisions is around really considering whether this is the right time or not to actually go to schools with a bid of some contributions financially towards the partnership. So that is behind, but it's behind for that reason. In terms of 15, so health and police gradually increase their contribution over the next 2 years to ensure equity of funding. quite a few meetings have been had with the strategic partners, and at the moment there has been agreement on, in terms of the progression towards equity of contribution across the three partners, with starting off with a smaller percentage, so the LA contributing 50%, health and the police contributing 25% in the next financial year. So I'm talking 2021-22, and then progressing to equal contribution of 33.3% for the next financial year. Those discussions are being had, and health and the police have taken those back internally to have those discussions, and we're just awaiting a response on whether that will start and happen starting this next financial year. So all of those discussions have been had. Request letters have been sent out. We're just waiting for the police and health to come back to us. In terms of action point 26, I think I referred to that a bit earlier. So that's around Thurrock LSCP to consider the appointment of an independent chair and scrutineer. That's something that came up in the report, and it was felt that in order for us to provide independent scrutiny and somebody to actually help us with progressing the work effectively of the LSCP, that would be a good appointment to make. Strategic partners agreed, and we've set that action in motion. The job has been advertised. It will close at the end of February. We've set a date for interviews in March, and we're hoping to get somebody in post as early into the new financial year as possible. I'll end there and take questions, Councillor Anderson.
Thank you for that report, Priscilla. A theme I've spoken about in the past is sort of inter-agency working. Obviously, the report mentions it itself that you know, the partnership is between agencies that work collaboratively to bring about these improved outcomes. Now that you've been in post for 3 or 4 months and you've been working on this, how have you found the sort of interagency working, and you know, the buy-in from others, and how have you found it all from your experience over the past few months?
So certainly since I've started, I've done a few cycles of meetings, so strategic meetings and subgroup meetings, and the discussions and the work that continues to be discussed is done really well. There's lots of conversation, there's lots of agreement. Where there isn't agreement, there's definitely stiff challenge around certain areas that maybe one partner is wanting more on. So there's definitely challenge from partners either way. We're making sure that we're monitoring what's been said and what's been agreed at meetings, and the work is following through. So if something is agreed that a partner will do or an agency will do, we're monitoring it and it's actually happening. So I can see that multi-agency working is working effectively from where I've seen in the last 3 and a bit months, definitely.
Okay, that's positive. Do we have any hands up for this one from members of the committee? It doesn't look like it. No. Well, Councillor Muldowney.
Thank you. I'm surprised there's no questions whatsoever from anybody else. Okay, I've got questions. So I don't think it was in any doubt from the review that we looked at last time that there is good working between the partnership organisations. I don't think that was an issue particularly that struck me when I read the report. One thing that you didn't touch on in your report that I just would like to ask about, because it was to do with MASH, and obviously listening to safeguarding reports in general, and also looking at what groups are actually the groups that people escalate to. The MASH, the multi-agency safeguarding hub steering group is key. But that was one of the things that was brought up in the report, that it wasn't, the governance of that wasn't into the local safeguarding children's partnership, and that should be. Now, I may have missed it, but I don't recall, it's showing red on my action plan that's
okay.
to happen.
Yeah, so that
Okay.
is showing red in terms of the papers that went out. But since the papers went out, and I believe that I submitted my action plan about 2, maybe 3 weeks ago, certainly the first week of January. So obviously there's been 3 weeks worth of work that's been done on it. So that's now amber because a date has been set to have those initial discussions with the MASH steering group chair, and that meeting will take place next week. And so that's why it's not red, it's amber. So it's about how we progress the action and ensure that the governance is via the LSCP. So you're right, yes.
Thank you. Yeah, because that just seems like a really important point, because it's just seemed a very key focal point for escalation, and it wasn't actually part of the governance in terms of subgroups. I mean, in the report it said that there were lots of subgroups and there was lots of meetings, and maybe there was some duplication of meetings, and that there kind of had been a review and a new structure was set up, but partners didn't really feel that that had reduced the amount of meetings. So I wondered, had there been any movement on that? And the other main area connected to that was about the shared priorities. I know you said that they're still red at the moment, which, I mean, it seems like that needs to be sorted out before other things get sorted out, really, in my mind. That's quite a top level piece that needs to be in place that other things cascade from. But obviously you have managed to move ahead with some of the other things, but those are all, that's the red areas at the moment. How much is that holding back progress in other areas, the fact that shared priorities are not quite worked out for whatever reason? I mean, I know COVID's probably impacted on that in the same way as we've heard from the other report.
I don't think it's been held back. I think what the report and the recommendation suggested is that we produce a joint document that shares the priorities from across the boards, so that we can see at a glance, so that we reduce the duplication. So on a page, I suppose I can use the same analogy as a briefing on a page, a plan on a page of where the priorities are for all of those boards there and how they interlink. And then once we do that, that gives us the impetus to think about the work that we are doing already and how we're feeding into each other, so that we're actually working more collaboratively as boards. I mean, we do that work already, but I think it's about sharing what we do and how our priorities are coming together on a document. So it's not holding, to answer your question, it's not holding the work back. The work still goes on. It's just about making sure that we can see what our priorities are shared across the board and how we present them to others.
So you're clear within yourselves that you know what your priorities are, but it's just not being shared to a document?
Well, it's not just about the document. We're clear in terms of each board. So I'm clear what the LSCP priorities are. I may not be clear in terms of adult safeguarding board or the wellbeing board. So it's about coming together, discussing them and producing a joint document that shares all the priorities. So I suppose it's about less working in isolation, but more so together.
Right, so now I see how it would cascade down, and that would stop duplication.
Yes.
Further down. Okay, yeah. Yes, the other thing, it might have been covered actually, but on page 12 of the original report, Sheila may have already answered this, but it was about the threshold document. So obviously, as part of this review, although it was very thorough and we've ended up with 26 action points out of it, the reviewer wasn't actually able to look at the revised threshold document. So I just wanted to ask, now that document's been available and circulated, the reviewer said that because he hadn't seen that, he was not able to review the effectiveness of information sharing or evidence, how the partnership and monitoring multi-agency decision making. So is this captured in other areas? How is that being monitored?
So in terms of the threshold document, the reason why the reviewer was not able to see it because it was still in progress at the time, and my understanding is that the report was written and published in August, but at the time of the visits to collate the report, that was done early in the summer, and that was at the time that it was being revised. And not long after the report was published, that threshold document has gone out and it has been circulated. It's certainly on our website, and partners and agencies have had it in the same way that we've circulated and got feedback for the escalation policy. We've done the same with the threshold document as well, and we get feedback in terms of our subgroups and with how that threshold document is being used, and if there are any issues in terms of the threshold, and whether agencies and practitioners understand and utilise the threshold document and understand how it's used.
How would you say that feedback? What feedback have you had, and how would you say, how well would you say organisations do understand their place and the process involved?
So my understanding, which I hope you'll understand is limited because it's been 3 months, is that there have been discussions at subgroup meetings, and partners and representatives feedback in terms of how they've used it, in terms of what thresholds have been met, and whether there have been any discussions or disagreements in terms of thresholds and what's happened. So are some of these cases that don't meet threshold, what support is put in place for those families, and how is that carried over? Is it a case of you don't meet the threshold, okay, sorry? No, it's about what else. If it doesn't meet the threshold, what else can we do to support? What else is in place that we can put for families?
That's really good to hear, because I think that was such a key point that came out of the review that we just looked at. So it is good to hear that and it was the point for me that was missed in the independent review. So it's good to hear that is taking place and your feedback on that. Thank you.
Thank you, Councillor Muldowney. Sheila has the hand raised. Would you like to come in, Sheila?
Thank you very much, Chair. I had my hand up on a number of points, so if I can, some of them have been probably responded to now, but I just wanted to say on the MASH governance board, I just want to be clear that the MASH steering group has been in operation for some time. It's a multi-agency meeting and it's been doing some really effective work. What was good about having an independent reviewer come in is what they said was, well, why isn't it linked into your LSCP? Because it's a multi-agency meeting, it's covering some really great stuff. That should be in your governance arrangement. So that's absolutely fine. And and it's sometimes when you have someone look new at something, you think, actually, yeah, that's a great point. We can do that. It wasn't saying there was anything wrong with the steering group or the work of the steering group, but actually saying it's quite good. Why don't you link that into your bigger partnership working? And when someone says that to you, you go, actually, you're dead right. We will do that. And so that is happening. I think the thing about the reports, I just wanted as well, I know Priscilla did answer this, as she was talking, was each board does have priorities and we know what our priorities is. So I wouldn't want the committee to think that the LSCP doesn't have priorities and doesn't know what they are. I think, again, having somebody outside independent, what they were saying to us was, well, why aren't you linking up more closely with all these other boards who, in a more general way, have some input into safeguarding as well, whether it be children or adults. And again, that's a great idea that we are now implementing and making happen. And I suppose just my general comment would be, is that's why it's good to have someone independent come in and have a look and say, you've got that done, but actually you could improve on that, or you could take it to the next level, or you could do another stride on that. And that's why we're open to having, external people come in and have a look at what we're doing so that we can always improve, always do better. And, I'm really looking forward to recruiting an independent scrutineer chair, because that will then again bring us on to another level. And hopefully if we've appointed that person, they may want to come to the next meeting and introduce themselves, which would be rather good.
Yeah, that would certainly be welcomed. I can't see any more hands up. No. Okay, well then we will go to.
Sorry, can I just come back on a final thing that I forgot to ask actually? The final element for me was about how you know that frontline practitioners know and understand a newly implemented policy or strategy. So I think this came up under, somewhat under learning hubs, but somewhat under quality assurance as well. So there was a number of points on the action plan where there was no reported formal mechanisms to ensure. So I just wanted to make sure there was that. And the other point for me was about the child's voice, because that does keep coming up as a theme. So I just want to, make sure that we're keeping it at the top of the agenda. But yeah, it's great having all these policies and strategies and whatever, but how are we disseminating them to the people who are actually doing the face-to-face work with children on the front line? Because that is where you're going to actually make a practical difference for children and their families. So there was a bit under learning hubs from the report which said that there weren't formal mechanisms, and I think that was picked up by one of the action points. I don't know which one. There was also a bit under quality assurance where that question was asked. How do you feel that you know yet, or is that still being worked on? And
So
what are the plans for that area?
yeah. So part of the plan is that we would canvass frontline workers, so via their our systems, so developing systems where we can go straight to frontline practitioners and ask those crucial questions. Do you know? How do you use? And making sure that we're just getting them, having a process of questioning. Maybe we haven't richly finalised this process, but it'll be a process of questioning and canvassing frontline practitioners in terms of, do you know? How well do you use it? Are there any gaps? Do you know where you can find information, training or awareness? And that way we can then see how well those channels are working and what we need to do differently. And that will follow a rolling process, sorry.
Thank you.
Okay. Well, it doesn't look like we have any other hands up. So I'll go to my final question, and I do recall you I think mentioning action number 14, Priscilla, in your sort of opening presentation of the report. So apologies if I missed this, if this is an oversight on my part, but the sort of update on that is that strategic partners met in December 2020 to consider a bid to the schools forum, and a further meeting will take place on the 19th of January, which obviously was a week or two ago now. What came out of that meeting? Is there anything further you can update on that?
Yeah, so the discussions were to consider a bid to schools forum, and in the consideration it was felt that with the current health situation and the pressures on schools currently, is this the right time to be approaching schools forum for a bid for contribution, or do we need to have these discussions and maybe think about a bid later on, because schools are under immense pressure at the moment, financially and resource as well. So it's about, yes, that on the timescale is behind, but it's behind for a reason. Is this the best possible way to approach schools? Can we support schools by maybe holding off that decision for a period of time once we know where we are with that? I think Sheila wants to come in on that as well.
Yeah, Sheila?
Can I just add, Councillor, that we are also looking at financial contributions to the LSCP in the round across the strategic partners, because I think you'll see in the report, it's very weighted towards the council, and there are 3 strategic partners here. So when we're looking at the financial contributions to the partnership from the police, health, ourselves, we will also include schools in that. So I think we are doing a piece of work right now. Hopefully when we get a new independent scrutineer chair, they'll also play a role in looking at how the partnership is more equitably, shall we say, funded.
Yeah. Okay. Well, I'm going to go to the actions, or the recommendation rather, then, as we have no other hands, and there's just a 1.1 committee provide comment and challenge to the action plan and recognise progress to date. Are we agreed? Yeah, I can see nodding heads. Okay, well the next item on our agenda is our third action plan update, and that's the SEND inspection outcome, and that will be presented by Michelle.
Oh, good evening, colleagues. Thank you for that, Chair. I guess where I wanted to start, recognising that we're coming to the end of the municipal year, and I just want to take the opportunity to thank committee, because actually you have provided real scrutiny and challenge for us whilst we work through our action plan, and I just wanted that formally noted. You'll see in the report that I've focused on, again, the voice of parents, carers and children and young people. The Youth Cabinet articulated it far better than I did in relation to the work we've been doing with young people, and they fed back what's happened and what we've done about it. I think the other thing that I spoke about in December, and I think it was recognised at last committee, we have meetings in December and there's a small window to update the report before it has to go through the systems to bring it back. But I am pleased to tell you that we've hosted, as I said we would, a number of events now around the relaunch of our local offer. We recognise that our local offer needs some updating. It's been in place for a long time. What I would reassure committee is that actually when Ofsted reviewed it, they felt it was fit for purpose. But because we're in a whole system change, because we're looking at sort of updating things, we are taking the opportunity to update our local offer. I had a Teams meeting, sometimes I think it's Zoom, no, it was Teams this time, a Teams meeting at the weekend with some parents, and I have to say, they gave some really, really helpful feedback to us that will enable us to move on and develop, the local offer. We're still on track. I've put in the report mid-March. It may be sort of the sort of end of March. I'm hoping mid-March, because we want to make sure we're giving people the opportunity to feedback as to where we are. The other thing I wanted to talk to committee about, and it really builds on some of what you've been hearing from the previous two reports, and that is about independent review. That is about where we are, how are we doing against, the written statement of action. We recognise that actually we possibly, if we hadn't have had COVID, we'd have been preparing for re-inspection. So our re-inspection time would have been any time from March onwards, that window. That will be delayed, colleagues, because of COVID, and Ofsted actually haven't been out sort of doing any inspections. So what we've requested is a review from our colleagues at the regional offices from the Department of Education to come in and just really work with us about where we are against the written statement of action. So, and I'm pleased to say that will take place in the middle of March, and I will certainly bring the report back to committee in the next municipal year as to how we've actually, what their findings is on that. And I think it just builds nicely on what you've heard earlier, and certainly coming from Sheila as our DCS, really clear about having that external lens on the work that we're doing, so that we can really look at sort of, what progress we have made. Always remembering actually that the child and the young person are at the heart of this. It's about ensuring that we have got good quality plans that actually make a difference to the child and the young person. Not a lot of point, colleagues, in having a plan that makes no impact, no difference to the child or the young person. Absolutely making sure we're capturing the voice. We've given you some examples about how we're trying to capture the voice and what we're trying to do to address that. And also working really, really close with our parents and carers. What really resonated with me on the call, at the weekend, again, parents and carers saying how tough it is. It really is hard at the moment. And I know there's been some sort of groups set up to support parents, because we recognise that, whole system approach. So I think, Chair, I'll probably leave it there, because I'm conscious that, as I say, the clock's probably ticking on me. So I'm happy to take any questions. But just to say thank you to committee. You have provided us with that challenge, and governance was a key area in the written statement of action. So, we will be providing all of the reports that have come from ONS, all of those questions that councillors have asked as evidence of scrutiny around the work that we're doing. So I'll leave it there, Chair. Thank you.
Thank you for that, Michelle. I'll go straight to committee to see if we have any questions or comments for Michelle on this report at the moment. Councillor Muldowney.
Thank you, Chair. Yeah, I mean, it feels like that good progress has been made on the statement of action, definitely. I did a little summary of where we were on all of them. There's just a few minor concerns. I think I was a little bit concerned under A2 that the NEET figures had gone up to 13.2%, but given the backdrop of what's happening with youth unemployment, that's not terribly surprising. It's good that we've got a good tracking system so that we do know where our young people are. So that keeps our NEET unknown figures down, compared to other boroughs. So that's certainly something that's good. But I think that's gone up from 9.8% or 7.5%. I couldn't quite make out what the last report said. Yeah, so that was just a little thing to keep at the top of the agenda. What kind of, have you got any thoughts, Misha, about how to address this moving forwards? I mean, it might be difficult at the moment with us. Well, it's probably impossible at the moment with us actually being in lockdown, but what's on the horizon to deal with that? The other thing that I was slightly puzzled about, so I mean, if we look at A1, it's all blue, A3 is pretty much embedded, A4 is embedded for a year now, so that's all good. Some of the actions have gone to green from amber, and I wasn't quite sure why, because when I looked at the progress update, didn't seem to be much different to the last report, so maybe you can shed some light on that. But that was A2 and A5, B1. Obviously, the parent carer group is moving ahead, and it's good to hear that you started working on the local offer. Ofsted may think it's good, but I did actually try, as part of participating in those parent carer groups, I did try and find some information as if I was a parent or carer, and it was really, really almost impossible to navigate, and what I did find just didn't seem to be relevant or was out of date. So I'm really glad that you're doing that piece of work, and be interested to hear more of that. So that's obviously the one that we know is still on amber, but there were quite a few others that have gone to green since last time. I wasn't quite sure why, but maybe you've got the explanation, Michelle.
So shall I start first with around the NEET figures?
Yeah.
I think that was the first one that was talked about. So yeah, I mean, absolutely recognise that. I think I reported to committee last time that actually we were successful in our Kickstart programme, which is great news. DWP have had some delays, partly because it's been so successful, so oversubscribed, which is really good news. But we are now moving on that programme, and we've targeted in the local authority. So the local authority have got 30 opportunities, and we're certainly looking at what we can do to support our SEND learners in relation to that. So we'll be looking to do that. I think the other thing for me about looking at sort of young people who are NEET currently, what we're looking at, and actually we will be able to, once we can get them uploaded, we've done some really great videos actually of some of our programmes. So we've got supported internship programmes, we've got a number of post-16 programmes now. That was one of the areas that actually Ofsted sort of picked up on, to be honest. What they said was that actually there are programmes, but perhaps they don't give the progression, or perhaps they're not really sort of meeting the needs, of young people at that particular point in time. So we have produced some videos of young people actually talking about their experiences. Actually, if committee would like to see, I'm happy to send them around to committee. We should be able to log on and actually see them, because they really are great. They're great to see, young people really sort of talking so well about the provision and what they're doing. I'm sorry, Councillor Muldowney, apologies. I haven't got the written statement in front of me. So when you're talking about the ones sort of going from amber to green, I'm happy to try and take them now. Or alternatively, what I can do is just provide an update to committee if that's easier. I'm happy to talk through, but it's really difficult because I haven't got the copy in front of me. So, you know, as I said, so I'm happy to do that for committee if that would be, you know, the way forward. I think where I've moved them to green, it's where we've seen some progress. So for us, the embedding is blue, as we use blue around the embedding, don't we? Green is that, you know, we're doing the work. Amber is the work has started. And clearly we haven't got any reds on the plan, but I just think I'm more than happy to provide that update, you know, outside of this meeting, if you'd find that helpful.
Yeah, that's fine to do it outside of the meeting. If you want, I can email you through the ones that I looked at.
Yes, please, Councillor Muldowney, that'd be great. Thank you very much, and I will respond.
The only other thing you might be able to speak to is the quality assurance visits which took place on the 11th and 18th of December, because I know that you said that no areas of concern were outlined, but I would have quite liked to have read those or know what did they say.
But do you know what, Councillor Muldowney, I'm very fortunate tonight because actually I've got one of my colleagues, one of my team is on the call who leads on the quality assurance visits for specialist provision. So, you know, as I said, Malcolm, I don't know if you want to take that briefly for Councillor Muldowney, please.
Thank you.
Yes, thank you, Michelle. I can pick that up. Yes, the quality assurance visits that we carried out with two of our independent specials. We've got obviously we've got a program of quality assurance visits that we're doing for all our independent special schools, which of course are virtual visits, and they were key issues we just wanted to pick up around offset issues that have been picked up in previous inspections. The reason we prioritised those two in particular is because there were some offset issues that they had identified, and we wanted just to get their update on that. We were satisfied with the answers and the progress they gave us. We went through in detail, though, the full areas of the QA process that we would go through at any other meeting. So we went through a whole series of information around not just their sort of formal offsets that had taken place and the actions around that, but other issues that we check in terms of their paperwork, in terms of the contacts, in terms of safeguarding, their links into other services, the responses back around children, obviously issues around children's progress and issues around the other sort of data that we get from those services. But it's a detailed discussion predominantly around the key issues for them as an organisation to ensure that the quality of the service they're delivering is appropriate for the needs of our children. I should emphasise, of course, this is a QA visit, and in many ways we implemented this year. We put this programme in because there is a centralised system called the CCRAG system, and that wasn't giving us, we felt, sufficient information or the depth of information that was required at that time, even though that was in fact the national system that we were part of initially setting up. It's still very good for the children's social care placements that they're followed up, but however, it's being looked at again in terms of the educational placements, the school placements, to revitalise that a bit. But in the interim, this process we put in to cover all the things that we would have done obviously previously with that system, but to give us a very individual discussion with the head teacher and normally another senior member of staff to go through issues pertinent to the children we've got there, but broader as well in terms of how they're dealing with the overall situation. Of course, the focus on those two was very much around how they were delivering their service in terms of the pandemic, you know, how many children they've got in, if they had children and they were still on the residential side, not across the school, how they were supporting their needs, you know, how they discussed that with parents, what the other engagement was around those issues. So that's the sort of broad overview, but we were perfectly satisfied with both of those QA visits that we went through. They were able to answer all the questions we wanted. And I should emphasise, of course, that these are QA visits in addition to the annual reviews that take place around the education and healthcare plans, which is a specific discussion around the individual needs of those pupils and their progress. And of course, it's an addition to any social care visits that might take place for those children who are looked after and attend those settings, because of course there are additional visits that go in and additional checks and processes around the whole looked after situation, which includes obviously contact from the virtual school as well. So those two we're satisfied with, and we've got an ongoing programme. In fact, we had one QA visit, a large QA visit, in the sense that it's an independent school, but we've got a number of pupils there. We've got about 8 pupils there that took place yesterday, and we're just waiting the feedback from member of staff around that. But the initial informal feedback was again positive, that they were able to answer all the questions, that we were able to update on that. So that's the process so far, but obviously happy to provide further detail on that as needed. Thank you.
Thank you, Malcolm. And just to finish on the local offer, Councillor Aldoni, I absolutely share your concerns around that. I think the comment that the fact that Ofsted didn't pick it up, actually they didn't pick it up, but we certainly did. And I think, you know, it's absolutely important that we do get that refreshed and actually involving parents, carers, children and young people in the delivery and the design of it. So, you know, that's where we're sort of heading with that one. Much better functionality. So that's one of the key things for me, really much better functionality. So, you know, as I said, I'm looking forward to seeing it myself, actually. So thank you, Chair.
Okay. I do have one brief question myself, but I will still offer it to the committee before I go. Are there any hands? No hands. Okay. The only thing I wanted to touch on, Michelle, was obviously as we know, the amber rag rating is an action that's been started, but there's delay, whereas green is on track to be completed at an agreed date, and the B3 engagement with children and young people, all the individual sort of points are green. There's a blue one, an embedded one, but on the overall where you have the monthly sort of rag rating, it's yellow. So we've got greens and blues, but we're saying it's yellow, and that seems to be a bit of a discrepancy to me. Are you able to speak to that?
Okay, I'll have to look at it, Councillor Anderson. It could just have literally been that we just didn't change that colour block. That's the reality of it. We probably just didn't change that colour block. As I said, it's an interesting document to sort of actually manage, because you're going through different parts of it. But I suspect that's all that is, Councillor Anderson. But I will look at that and make sure that is updated.
Thank you. Okay, well, as there are no hands, I'm going to go to the one recommendation again, to scrutinise the work that's been undertaken during the period outlined in the report and offer support and challenge. Are we agreed with that? Yep, I see nodding heads. So we will move on to our next item, which is item 9, and this is the Thurrock School Wellbeing Service, and I believe this is Malcolm presenting.
It is. Thank you, Chair, for that. So this is a report that's come back to overview and scrutiny. As you, members will be aware, this was last reported on in October 2020. So this is an update report. I've obviously included amongst this some of the previous background so that people understand the basis of the service, where the service came from, and the other factors behind that. And I've included, obviously, in the report, in addition to the overall aims, the service objectives that people that have been seen before, and the key performance indicators, with an update, obviously, on the performance around that KPI scorecard there. But probably the best way to approach this would be to look from section 7 onwards, which picks up on the improvement areas and progress, as this is very much reporting on where we are at the moment. And the first thing I'd like to say is, again, when we reported back in October, in post was Gemma Fitzgerald as the lead for the service. Now, Gemma was successful in going for a promotion post in neighbouring authority. She's gone back into a slightly more clinical role, but in a more senior capacity. Therefore, Gemma's post became available. We obviously wish Gemma well. She's done a fantastic job in establishing the service. And Jackie Hurahan, who's on the call, on the meeting, this evening, has stepped up as the lead for the service, and thus Jackie's name is on this report as well, of course. So that's the initial feedback in terms of the staffing. We have decided in the interim, or immediately, not to backfill on Gemma's post, but we're obviously reviewing the staffing situation as we move forward with this service. Of course, the service has been working on a virtual basis. And I just wanted to touch on a couple of things in terms of the pandemic. Clearly, we know that the pandemic has had a very significant impact, and committee members will be aware of this, obviously, in the national media as well, on the well-being and the mental health of children and young people. And that's for a range of reasons. And this very broad service picks up the broader aspects of children's well-being, not just the links into mental health. Now, we know from the information receiving back directly from schools and also from the research that's been carried out so far that a particular concern, and it's been picked up already this evening, has been children's sense of isolation and loneliness during lockdown. And there's some actions have been taken around that. But obviously, we're also providing support around that. But also absolutely crucial to children's well-being, which is being looked at and discussed with school staff as we go through, has been children missing out on life events, missing out on friendships, missing out on opportunities. And that goes for all age groups, but particularly for teenagers who form their own social relationships through their independence from parents, those opportunities to meet up with friends. And they haven't had that for almost a year. And that has been very significant in terms of the opportunities they've had. And it's a very great credit, I think, to our young people that they have been able to cooperate and take part in the very significant impact that they've had as a result of not being able to meet up with their friends, not having those social events, not having the big events, but also not having the small events that they have, which is absolutely vital to the well-being and the development of our young people. And I think that needs to be recognised as we go forward. So in terms of this service, the discussions we're having have been with schools, and the support for schools has been at a range of levels. A lot of it has been around staff support and has been around offering staff reflection sessions. We should also remember that staff well-being has been significantly adversely affected by the pandemic, and we've talked to a lot of staff about the stress and difficulties that those school staff have. And of course, we have to recognise that it's those school staff who've been very much in the front line. It's the school staff who've been going in every day. As Sheila mentioned earlier, our schools are very much open. The important thing for people to remember is that not all the children are attending. All those staff are working very hard, and the vast majority are going in on a regular basis in order to provide those sessions, whether it's online or whether it's direct teaching. And the demand has doubled for those teaching and support staff because they're having to do two things. They're having to support the children in school and at the same time provide an online offer with all the planning and additional demands that brings to it. So clearly there's been a lot of anxiety and there's been a lot of concern from those staff about how they're coping with that, how they're dealing with it. And I think schools, again, and the management teams deserve great credit for having taken into account the whole school's wellbeing agenda, worked with those staff groups and supported them appropriately. And the school's wellbeing service has been our important link into that. So there's been lots of partnership working. I should mention that we have a senior psychologist that we appointed recently who now links into the school wellbeing service directly and works very closely with Jackie, and both of them obviously report directly to myself. So we've got a clear link in with the school psychology service and the support line we've been running. And we've also got very good links into our National Health Service support arrangements, both the what local CAM service, which is known as the UM service, and of course the mental health support teams, which is the new service that's come about as a result of further developments, which provides direct support to some of those schools as well. So those links are very strong, and including the links with Open Door and Mind, our local third sector organisations. And I was on a meeting with both Jackie and Natasha earlier today, where we were planning at the next stage of actually that link up with those groups. So we're providing a conduit and support service across those different agencies who are providing support at this time during the pandemic. So you'll see there the summary around the work that's taking place. We continue to work with the University of East Anglia around the monitoring the impact of the service, the work as it goes forward. And that's including things such as the School Wellbeing Service Pledge, organising with schools their own action plans that are taking place. But a very important part of this service is to carry out and support the Brighter Futures survey, because that's our key piece of information around mental health across schools. So it's a targeted survey on particular year groups. It asks in-depth questions, and the service continue to support that as it goes forward. And we've used that obviously for a range of planning and support arrangements across other programmes to support children's mental health, both from public health, from the education psychology service, and from the school's wellbeing service as part of that. So you'll see there's discussions there, and we've already heard from Youth Cabinet this evening about the youth forums and the links in with the wellbeing service that's taken place. And we're very grateful to the work that's been carried out by the Youth Cabinet. And as was mentioned this evening earlier, this issue around social isolation and social opportunity, and particularly for those more vulnerable groups, those children with special educational needs and disabilities. And already action has been put in to follow up from that work, which has included a new virtual offer for those young people to help them with that sense of social isolation. You'll see within the report as well, there's particular activities to support children who are looked after, again, another vulnerable group, and the Schools Wellbeing Service have continued to support both across the general work with schools and actually including a very engaging presentation they did to looked after children around about Christmas, but touching on the whole area of mental health support and wellbeing support with those individuals. So there's work across targeted groups as well. And finally, you'll see the last one on the actions here is actually the work around permanent exclusions. Now, as you'd expect, of course, permanent exclusions are down at the moment, both secondary and primary, due to the fact that children haven't been in schools. We were expecting actually a slight increase when schools first went back post the first lockdown. It wasn't as high as we thought, and so our overall level of exclusion is still down. But we want to provide particular support for those children through the Schools Wellbeing Service, because of course a lot of those children whose difficulties result in them being excluded from school have come about because of their own difficulties within their general well-being. It might be around their life circumstances, their anxiety, etc. So there's some further work that's planned to take place to support them as well. The key area of support that brings this together is something called the Wellbeing Education Resilience Programme. And I just need to mention this to overview and scrutiny, because this is the DFE funded programme, which was developed in conjunction with MIND and the Anna Freud Centre, the National Centres of Expertise for this work, and it produced a series of webinars and other resources based around wellbeing and resilience. Now, each local authority was tasked with developing their own particular slant on that, and so what we've done is we've re-recorded some of those sessions, we've used some of those materials, but we've also tied in other work we've got on trauma-informed practice that we've been working across South End and Essex with, and that programme is going out to schools, both in terms of webinars that the schools can download themselves and ongoing conferences and consultation work. Now, as I said a moment ago, there's work on a regular basis linking into those schools, talking to staff, making sure they've got those feedback sessions, but there's also bringing together those wellbeing practitioners together on a regular meeting so we can actually make sure we're rolling out those programs support. And of course, we've also continued the work with the Schools Wellbeing Service and Educational Psychology Service for a telephone support line. So there's direct access both for schools, for parents of young people to phone up to make an appointment and have an opportunity to talk through some of those issues. So I think that sort of covers the broad areas within that report. And obviously, I'm happy to take questions, but equally importantly, Jackie is also in this meeting and is happy to provide any further details. You'll see we have given a brief summary that, as with all the other reports, was written 2 or 3 weeks ago, and we've got further information on particular activities that have taken place, obviously, in the first few weeks of this term, which we can update on as well if people would like any further detail. Thank you very much.
Thank you for that report, Malcolm. I think the first thing I just wanted to say was just to make a comment, and that was with regard to the sort of, support line that was set up for parents, carers, school staff as a result of COVID. I think that's really positive. I think it's really good that we've got that support line, and as the report mentions, it supported a significant number of school staff. So my plea really was just to ensure that the schools and parents and carers, we do as much as we can to make them aware of this support line. The report does say that new communications will be going out to parents to ensure that they are fully aware of this, but it's just to make sure that we do everything that we can, because I think that's a really sort of positive feature of this wellbeing service. Are there any questions for Malcolm or any other members of the team? I can't see any hands. Councillor Rigby.
Hi, thank you, Chair. Yes, thank you. It's a brilliant report, Malcolm. Thank you. And obviously a very, very important subject, both for students, and you also mentioned the toll on the teachers as well. How is the communication going out to pupils and to parents to know that these services are available?
So through a number of different ways. I mean, I mentioned that we've got the actual leads come together. So the schools wellbeing leads come together on a regular basis to make sure that the information from the teams have gone across. And we've got the psychology service, obviously, and the schools wellbeing service attending those meetings. We've done a number of distributions through email directly to all schools, and what we've done deliberately is bunched that information together into packs so they're not getting drip fed, because one of the challenges with this, of course, is there is so much national information coming out from a whole range of agencies that we wanted to sort of bring things together and have the links into that as well. We've also got links onto the mental health wellbeing websites that are established, and some of those are long established as part of our work across Essex and Southend as well. So there's a link into that, and we do it through a number of different contacts with schools. Myself and Joe attend the Safeguarding Leads meeting, which is one of the important links we have on a termly and sometimes twice termly basis with the Safeguarding Leads in schools, and we often touch on this area as part of that. We have, as I said, we have the wellbeing links here. We've brought it up at the head teachers briefings. We've made reference to it within the Senko forums as well. And we've, as well as sending the information out, we're sort of having those regular one-to-one discussions with schools through those leads from the schools wellbeing service and from psychologists, reminding them of what information's out there, reminding them about the telephone support line as well, and the ways of booking onto that. And we've encouraged schools to put that out through their own publications. We've also obviously touched on our own communications team, but what we wanted to do was link into the schools' communication particularly, because they know their parents, they know the best way of getting out to parents, and a lot of them have put that on newsletters or put it on sort of other information that's going out or out on their websites, and that's been the best way we've found so far of picking up on this information. We're about to put it out. In fact, there's been some publicity already, just because we wanted to warm schools up about it a bit, which is the Wellbeing Education Resilience Programme and the webinars that are going to be coming next half term. So we're going to be talking more to schools about that. And in fact, next week, both Jackie and Natasha, who are leading on this from the two respective services, are going to be talking specifically about those programs and doing a small launch of that to get those practitioners sort of fully informed on it prior to the actual webinars going online. So a number of different ways, and we obviously continue to look at new ways of doing it as well, and we'll welcome any further suggestions. Thank you.
Thank you, Malcolm. Nicola, you have your hand raised.
Yes, thank you. This is possibly more of me being a parent and may also answer your question, Councillor Rigby, but my son was chosen to be one of the mental health champions and undertook the training session from the schools, and he absolutely loved it. He relished it, and he actually was asked then to go on to some other boards to represent his school and continue it. So I can honestly say it's definitely out there in the schools. This is my son at the secondary school. We're having a mental wellbeing week. We're having a big mental wellbeing day tomorrow. We're wearing T-shirts inside out. They've been giving positive quotes, but all week they've been given little tasks, which is all about their thoughts and feelings. And although I can only talk for his particular secondary school, the service we've got, the support we've got has been outstanding, because I'm a parent and I'm struggling. I'm not going to tell any lies. It is very, very hard. My other son goes to a primary school. Again, we're having a mental wellbeing week. He's having a one-to-one session with his teacher on Friday to talk about his thoughts. They've all been asked to do little videos to say what their favourite things are, what they missed out of lockdown, what they're looking forward to. So it has been a really, really, it's the best week to talk about it, because it's really been out there. And everyone's doing it differently, but I can honestly say from a parent, it's really, really well received, and it is there. It's on Facebook, it's on emails to parents, it's on the Google Classrooms, is the platform we use in both the schools. So it's definitely there. It's just, I wanted to say as a parent, thank you for having that facilities and to teach the children, and just thank you, really, it really has helped.
It's great to hear it. Thank you.
Definitely. Jackie, I noticed you raised your hand. Would you like to come in now?
Yes, thank you very much. I just wanted to share, it's lovely to hear, Nicola. That's really lovely. Honestly, it really does make a big difference. But also what we are doing is we, as a team, we are allocated a certain amount of schools each. And within those schools, we have identified a mental health lead, which is a senior member of staff. So that is kind of how we communicate through them, and everything is passed through them. And we also have a termly network meeting where we invite every member of the network meeting to join us, and then we cover a lot of information, also handing out the support line and everything that we do. So yeah, I hope that helps as well. Thank you.
Okay, do we have any other questions or comments from Malcolm? It was great to hear of the sort of effectiveness and the support that's being provided from Nicola. That was really positive. But if we don't have any other hands, I'll move to the recommendation 1.1 on page 73, and that's for the committee to note the work that has taken place. And I think with Malcolm's great report, we've done that. Is that all agreed? Brilliant. Okay, we'll move on to the Councillor Akinbowen. You just raise your hand.
Yes. Just a quick question. Sorry that I didn't make up my mind on time because many of the things has been said. Malcolm, what I just want to ask is, as we know, these schools are under immense pressure right now, so may not be able to address all cases. For the more severe mental needs, are they may not be able to address more cases of severe mental needs. Are they being encouraged to seek local mental health services somewhere else?
Yeah, certainly, and that's a really important question, because clearly there are some children, we're saying there is a general impact across all children, but there are still some children who are particularly vulnerable and particularly sensitive to the circumstances they found themselves in. And some of those children, there's no question whatsoever that the circumstances had a significant impact on not just their well-being, but their mental health. We have had an increase in referrals for children who are experiencing more severe and complex difficulties, and this is being managed by our colleagues, obviously within the Emotional Wellbeing and Mental Health Service, our equivalent of the CAM service, which we call the UM service. So they are picking up. They have had an increase in referrals, understandably so. That fits in with the national picture. They're managing that through their existing processes, which obviously are the triage, the single point of access, the triage services. We've had some very complex cases where we've obviously also at the very heavy end of this, we're looking at, where we're having to access hospital services for some children and young people because of the complexity and the severity of their needs. So there is an increase, there is a concern around that. Those services are coping, they are still managing, and that's one of the reasons why we are obviously having this regular contact with both our colleagues within the UM service, the NHS CAM service, and also our colleagues in the new services that are coming out from NHS, which address needs at an individual level, but at a slightly lower level, which is the wellbeing service and the mental health practitioners service. So I think part of this is ensuring that there's good access to all services, those services talking to each other, we're picking up on where the pressure points are, and we're linking in carefully to both the Mind organisation and Open Door as our third sector, as Open Door has a significant presence in our schools around counselling services and other services. And we've also, of course, got other schools and academies who've employed their own counselling staff directly. But that was another reason for ensuring that we've got that one-to-one contact with the educational psychology service. So where we've got very significant cases, they're alerted to that and they can support that. And in fact, I've got a colleague who has providing some supervision today who is doing exactly that, where there's a very complex and very severe case in terms of the complexity of the issue of the young person who has to move on to further tier 4 services. And we're picking that up directly and talking to the schools about that to support their access into that, to make sure that everyone is aware of how they get quick and and appropriate access to the higher level services where appropriate, but we're also providing that service down through the schools, so they're helping that identification process. Because just as we were saying with safeguarding earlier, it's our schools that are the eyes and ears of these needs that are picking up those discussions around the difficulties those children are experiencing, and are often the point of referral in for our mental health services as well. So that's why it's absolutely key we continue to have those close links, and we're using the services in that way. But you're absolutely right, yes, that is a significant concern, and we're keeping a close eye on that, and we're obviously discussing that with our colleagues in those clinical services. Thank you.
Thank you, Malcolm. Okay, well, just a message from Wendy there regarding.
Thank you, Malcolm.
Thank you. Regarding suspending standing orders, are we all happy to do that? We've just got the one item left on the agenda. I can see nodding head, so yeah, we're happy to do that. We did agree the recommendation for that agenda item, so I will go on to the final one now, and that is emotional wellbeing and mental health service re-procurement, and this one's going to be introduced to us by Catherine.
Thank you, Chair. Good evening, everyone. I'm Catherine Wilson. I'm the Strategic Lead for Commissioning across Children and Adult Services. And I don't think I've been to this committee before, but I'm here this evening with my colleague Sue Green, who also leads on commissioning around children's services. So I'm here to present a report about the re-procurement of our emotional wellbeing and mental health service, which is what here in Thurrock and across Essex we call our CAM service, so our children's, adolescents and mental health services. Obviously, Malcolm has described them very well in his previous presentation, and how they link with the services, the school's wellbeing service, etc., within Thurrock. So the current UM service that we have in place has been in its current form since 2015, and it will be ending in 2022. So we are coming today to talk about the re-procurement of that service. Currently, it's commissioned through a collaborative commissioning forum, which is made up of the 3 local authorities and 7 CCGs across the Greater Essex area. And after careful consideration of a number of different options about how we might re-procure this service, we are recommending that we remain within the collaborative commissioning forum to re-procure the service. And very shortly I'll come back to the options that we've considered, just to give you a fuller picture. But I will just now move on to explaining the re-procurement. So the contract itself is worth £21 million, and Thurrock Council contribute £205,000 to that contract, but Thurrock CCG also contribute to that. The commissioning forum brings together those 10 partners, and therefore that money is pooled to be 21 million. The specification for the service has been rewritten and is currently being reviewed by partners to have final agreement to it. And it's really important that we learn from the service that's been in place. When we first put this collaborative service in place in 2015, we hadn't done anything like that before. The service was quite disjointed across Essex, and it was quite difficult to provide a seamless service for children and young people. The service hasn't been perfect over the course of this contract, but it is starting to work well, and it is delivering positive services, particularly in this difficult time. The principles of the new contract will be to ensure that it delivers our Tier 2 and Tier 3 services, so they're the services that follow on from the school's wellbeing service, to children from 0 to 18 and up to 25, where young people have special educational needs and or disabilities. and also for young people with very significant mental health challenges, as Malcolm has described, who may need to go on into adult service provision. The new specification is very much focused on equitable provision for children and young people, particularly those children that are vulnerable. Our looked after children, children with very complex health needs, with autism, those who may be misusing substances. It's very important within this specification for all the different localities that are within that footprint that there are locally based services that are easily accessible and available to offer crisis support 24/7. All of the access to services is facilitated through a single point, which adds consistency for that service provision. The referral pathways are integrated across, or will be integrated across, the whole of children's services, and as we've mentioned, including the school wellbeing service, which is really important that those links for Thurrock are there and serve Thurrock children and young people well. The focus of some of this of the specification is around ensuring that we have waiting times that are not too long for young people and respond immediately to crisis. That we monitor across the collaborative, but we also monitor very carefully here in Thurrock to ensure that our young people are experiencing and receiving a positive service. That we monitor the key performance indicators very well, and they are going to be outlined in the specification. And as I mentioned a moment ago, that we are really clear about what we have learned from the last 6 years of the contract to ensure that that integrated approach is locally based for Thurrock young people. One of the key aspects about kind of joining our commissioning services together is to be able to look at an all-age approach for mental health. We have a transformation board that's looking at how adult mental health services are provided, and it's really important for all of us that we link in with that work so that transition for young people into adult services is very positive. The changes within our health landscape are a challenge to us all, which I'm sure everyone is aware of, and I feel very strongly that remaining within the collaborative will give us stability in that changing landscape. To focus very much on our place-based work and our strength-based commissioning for children and young people. And having that local clinical approach, which links into our schools and wellbeing service, is really important, ensuring, as I've mentioned, a seamless approach to services for young people, so that young people do not slip through the gaps when they need to be referred from one service to another to support their mental health challenges and needs. So I mentioned right at the beginning that we had considered some other options which aren't detailed in the report, but I can send those options and that options appraisal to members, but I will just briefly go through them now. We did consider whether or not we should procure a Thurrock only service. And some of the challenges around that, whilst it may give us perhaps more control and autonomy, our financial envelope is not that large for this service. And so actually having the access to specialist services across the whole contract and having those economies of scale and the local delivery will benefit Thurrock young people. We thought about maybe just procuring part of the service and then linking into the wider contract, but that for us might create some difficulties in the seamless approach for young people and being able to move from one service to another. And so it seems more logical to maintain an overarching procurement. Another suggestion that was made to us was partnering with another local authority, which has not really been done before around CAMS or HUME services. and probably creates the most challenge of all, really, which is around the health system. The health system within a different local authority wouldn't obviously be the same as our own, and it might create some difficulties in accessing what is a very clinical need within the service at times, not always. So we looked at those options, but we did come back to the collaborative commissioning framework and really looked at how it has grown and developed over the last 6 years of the contract, and it has supported us to still have a local response, perhaps not as good as we'd have wanted all the time, but we are very clear within the new specification that we do want to monitor that more locally as well, and monitor those links more locally, which I think might have been missing a bit at the beginning of this contract that we've just experienced. And it gives us we've made sure within the specification that it gives us contract flexibility, so that if we want to reframe part of what's being delivered in Thurrock, we would be able to do that within the collaborative commissioning forum. And it's always possible to have a variation to a contract. But we were most keen around the fact that we want to prioritise our very, very vulnerable young people as well, and ensure, as I mentioned before, that there is an integration across all of our children's services, and absolutely links to our school wellbeing service, which is so important to us, and so important to have a good quality service and those links that will support our young people. I think I'd like to just leave it there. If there's anything you would like to ask, please do.
Well, thank you for that report, Catherine. It was rather detailed. The question that I had was, I think you briefly touched on it, but I was wondering if you could perhaps give committee an idea of how we're using the experience and learning of the past 7 years of the service to inform the specifications for the new contract. Are we like looking at that experience and taking stock of learning to inform those specifications going forward?
Yes, absolutely. So we've looked at how services are delivered locally in the different localities of the contract to ensure that the local teams function well. We've also looked at how the collaborative commissioning forum and its executive monitor the contract and interact with the providers. And I think it hasn't always been as positive as we would have wanted it to be through this last 6 or 7 years. And so we've really developed fully within the specification the monitoring tool and the key performance indicators to ensure that young people's experiences are far more positive. And we've also ensured that we look at how the referral pathways work and the integration with local services, such as our schools wellbeing service. I don't think that integration was very good at the beginning of the contract, and it's developed really well, but we're using that learning and have put that within the specification. So there's a number of different areas. There's probably more which I can share with you, but there are a number of different areas that we've certainly looked at very closely and had a dedicated specification subgroup to look at writing that specification to bring the draft together for comment.
Fantastic, thank you. I did notice, Alicia, you had your hand up. Would you like to comment or question? Perhaps the hand has been taken down. No, it's still, you're on mute, Alicia. Oh,
there we go. My question was very similar to Councillor Anderson's anyway, because I myself had quite a negative experience a few years ago with the service. However, I just wanted to emphasise to committee from a young person's perspective that I do commend the service now. The fact it is locally based is so much better to an experience that I've got friends across the county who have to trek miles to go to their local appointments pre-COVID, and the fact that it is so centralised in Thurrock is something that we should very much be proud of. And yes, I know there is quite a lot of negative experiences that have occurred, but I do see, like, reading the reports now, seeing what the service was like a few years ago to seeing is what it is now is something I'm very much proud to have seen the change. So I just want to thank you and Malcolm for what you've done to the service.
Thank you.
Thank you, Alicia. Are there any other questions? Questions for Catherine? Shout if there are. I may not see your hand. I can't see any hands. No. Okay. Well, we'll go on to the two recommendations for this report. Then they are slightly longer than the others, and there's two, so I won't read them out. I will just signpost you page 88, point 1.1 and 1.2. Are we agreed to those points? I am. I can see heads nodding. Okay, brilliant. Well, we've agreed that, and that was the last report of the evening. So I'll go on to the final item, which is 11, and the work programme. I did have a comment that I wanted to make with regard to the work programme going forward, but if there are any other comments from members of committee, I'll happy for you to jump in now. No, I don't think so. The only brief, Councillor Muldowney, go on, Councillor Muldowney.
Sorry, just to say, I meant to pick it up at the end of the LSCP item. Just that would be good to come back. Obviously, you probably plan to bring it back anyway, but I don't think it was formally said, so if that can be added to the work programme. And just to say, obviously, it's the last meeting of the municipal year. Thanks to everybody. I've really enjoyed working with you all this year. I think we've had quite a few tough issues, and there's been quite a few tough questions, but you keep writing recommendations asking for challenge, so I do feel obliged to give some. But it's been a really positive experience, I think, and hopefully services are the better for the work of the Scrutiny Committee. But thank you all very much. It's been a great experience.
Thank you, Councillor Muldowney. We'll make note of that. I think the LSCP was item 7, so if that can come back as Councillor Muldowney asks that'll be great. The only comment I had is earlier on in the municipal year we had an exempt session that looked at high-risk notifications, which personally I found quite a good productive meeting. I did speak with a couple of members of committee afterwards who thought it was a good meeting, certainly worthwhile. So I suppose I'll just ask Joe, because I think Joe presented it on the night. Are we can we see that come back in the next municipal year? Can we put that on the work plan, please?
Definitely, Councillor Anderson. I'll make sure that's on the plan.
Brilliant. Thank you, Joe. Okay, well, I think that was it from me. So unless any hands pop up now, no, I will just echo Councillor Muldowney and thank everyone for their input, attendance and contributions over this past municipal year. It's been a great committee to be part of, and I look forward to hopefully seeing a lot of the faces in the next municipal year as well. Thank you, everyone, and good night.
Thank you. Good night.
Thank you. Good night.